Assalamualaikum and hi everyone. So my name is Nabi Naufa and now I will start first with introduction and research. So first, cardiovascular heart refers to the proper functioning of the heart and blood vessels, including arteries, veins, and capillaries, which together circulate the blood, oxygen, and nutrients throughout the body. When this system fails or damaged, it leads to cardiovascular disease that is called CVD, which includes conditions such as coronary heart disease, stroke, hypertensive heart disease, and other disorders of the cardiovascular system. Gender matters in cardiovascular health because men and women have different hormone and body system. Men usually face higher risk earlier, while women risk either increases after menopause when estrogen drops. These differences affect symptoms, risk, and treatment outcomes. And now let's go to research that I found. So based on recent global data from 2021, out of a total of 166 million people living with ischemic heart disease, IHD, approximately 57 million were male and 109 million were females. When calculated, this represent about 34.3% males and 65.7% females, showing that in this data set, females had a higher prevalence of IHD than males. Okay, these differences highlights the importance of considering gender in cardiovascular health, as men and women not only have different prevalence rates, but also different in risk factors. So that's all from me. Thank you.
Today, I will explain the factor that affecting digestion in men and women. For men, digestion is mostly affected by lifestyle habits. For examples, smoking can reduce saliva and irritate the stomach, which make digestion slower. Alcohol can also cause acid reflux and make the stomach work harder. So, for men, the main factor are smoking and drinking habits. For women, digestion is more affected by diet and hormones. Before and after menopause, hormone level change, and this can slow down digestion. Can cause bloating or make the stomach more sensitive. Women also react more to certain type of food and fiber. In simple words, men are more affected by their habits, while women are more affected by their diet and hormone changes.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Zaki Faisal and I will continue with genetic predispositions. Some heart disease run in families because of genes, but these genes don't actually react the same for men and female. And that creates variation in when the disease shows up, how severe it is, and how the person recovers. For example, a gene mutation might cause earlier heart disease in men but milder or later symptom in women. There is three parts we can see, which is chromosome, hormones, and gene expressions. In male, there is X and Y, no backup X, which is can faulty genes show up quicker. But in female, there is double X. Second X can sometimes reduce severity. Hormones. Testosterone can increase inflammations and stress, but estrogen protect artery walls and heart cells. Gene expression. Heart damaging genes often more active in male. Meanwhile, heart protective genes more active pre-menopause, which is before menopause. A variation in genetic expression. Age of onset. Men usually show symptoms earlier, but women often show symptoms later, especially after menopause. Penetrance. how strongly the genes show symptoms. Men have higher penetrance, which is 2 to 3 more likely to show symptoms. Women sometimes carries for years without strong symptoms. Severity difference. Men more severe earlier disease like erythemas and artery blockage. Women slower development but may catch up after estrogen drop. So they should do regular checkup. Diagnostic difference. Men diagnosed earlier because symptoms appear earlier. Women underdiagnosed because symptoms subtle or atypical. This more likely make women have high risk after their menopause. Recover difference. Women often recover better from certain heart genetic conditions due to better microvascular function before menopause, especially. Men may face more complication because inflammation is higher. Example of genetic heart problem: familial hypercholesterolemia, inherit high cholesterol from birth. Men usually get heart problem around their 30s and 40s. Women's right women rates increase after menopause when estrogen drop. Erythemogenic right ventricular cardiomyopathy, heart muscle replaced by fat and scar tissue, more common and dangerous in men due to testosterone's effect on heart cells. Hypertrophic cardiomyopathy, thickening of heart muscle from a gene mutation. Men show symptoms earlier, women often diagnosed later because signs are milder at first. So, why it's matter? Doctors should check family history carefully for both men and women, so they can actually get earlier blood tests or ECGs can find problem before symptoms appear. Treatment can be adjusted. For example, cholesterol control early for men and extra screening for women after menopause.
Hi, my name is Muhammad Akmal Azim. For this slide, I will explain the common disease that usually occur among men in different age group. Men in their 20s to 30s, the first one, we have testicular cancer. Testicular cancer happen when abdominal cells grow uncontrollably in one or both testicle. The peak age for testicular cancer is between 25 to 35 years old, making it the most common cancer among young adult men. The second one, we have injuries or trauma. Young men are generally more physically active, adventurous, more likely to take risks. Because of this, they experience higher rates of injuries from accidents, sports, fall, or physical impact. Now we have men in their 40s and above. The first one, we have hypertension, which is high blood pressure. In this age group, hypertension becomes very common. Hypertension means blood pressure remains higher than normal because the force of blood against artery wall is too strong. The normal blood pressure is 120 over 80 millimeter of mercury, while hypertension starts at 140 over 90 millimeter of mercury or higher. The second one, we have heart disease. Heart disease involve conditions that affect heart structure, and function. The most common type is coronary artery disease, which happens when plaque builds up in the arteries, reducing blood flow to the heart. This condition is often caused by factors such as high cholesterol, smoking, unhealthy diet, and family history. Next, we look at disease that commonly affect women in different age groups. For women in their 20s to 30s, the first one we have depression and anxiety disorders. Depression cause persistent sadness, low interest in activities, and low energy. Anxiety disorders involve excessive worry and fear that interferes with daily life. These conditions are more common in young adult women due to emotional, social, and hormonal factors. The second one, we have polycystic ovary syndrome, PCOS. Polycystic ovary syndrome is a hormonal disorder affecting people with ovaries, usually during reproductive years. It is caused by hormonal imbalance and is linked to irregular menstrual cycles and the presence of multiple cysts in the ovaries. For women in their 40s and above, the first one we have menopause-related symptoms. Menopause is the natural biological process marking in the end of a woman's reproductive years, usually between age 45 to 55. During this time, women may experience physiological symptoms, cognitive change, and physical change. The second one, we have cardiovascular disease. Cardiovascular disease are disorders involving the heart and blood vessels. They are often linked to atherosclerosis, which is the build-up of plaque in arteries. Symptoms may include chest pain, shortness of breath, fatigue, and weakness. So now I will compare the overall disease between men and women. For younger adults, aged 20 to 30s, women have a slightly higher tendency to get disease, especially chronic or hormonal conditions such as polycystic ovary syndrome and depression. For middle-aged adults, 40s and above, both men and women are almost equally at risk of developing disease. When we're looking at overall health vulnerability, men tend to have a higher risk of fatal conditions such as heart attack and stroke, while women tend to develop long-term or chronic conditions such as depressions and menopause-related effects. In conclusion, women experience more disease, but men have a higher chance of dying earlier from the disease. For this chart, this chart shows that men at 47% at risk, while women at 53% at risk. So that's all from me.
Hi, let's talk about variation of cardiovascular outcomes. Firstly, if we look at mortality, men tend to die from cardiovascular disease earlier than women. In young adult age 20 to 39, men show higher premature cardiovascular death, mainly due to smoking, obesity, and hypertension. According to the Global Burden of Disease 2022, about 70% of premature CVD deaths were in men. In middle age, 40 to 59, the gap becomes smaller because women start to lose estrogen during menopause. Estrogen is actually protective to the heart. When estrogen drops, the risk of the ischemic heart disease and stroke increase. In the elderly population, 60 and above, the mortality rate becomes similar or sometimes higher in women because women live longer and are often underdiagnosed. Next, we look at recovery. Women generally have slower recovery after a heart attack or heart failure.
Interestingly, studies show that women respond better cardiac rehabilitation if it is started early and tailored to their needs. This happens because their symptoms are often atypical. They are sometimes diagnosed late and they receive less aggressive treatment compared to men. Men, on the other side, usually recover faster in the short term, but they have a higher chance of recurrence due to lifestyle factors such as smoking and alcohol. These differences are influenced by four main factors. First is hormonal. Estrogen protects women before menopause, while testosterone may encourage early after changes in men. Second is lifestyle. Men smoke and drink more often, causing early disease. Women face increased risk after menopause due to the weight and diet changes. Third is genetics. Some genes behave differently in men and women, affecting heart disease and progression. The fourth is healthcare bias. Women are sometimes misdiagnosed or treated less aggressively, leading to poor treatment. To summarize this, men tend to die earlier from cardiovascular disease, while women develop it later and recover more slowly. This shows that both sexes experiences cardiovascular disease differently, not just in when it happened, but also in how well they survive and recover from it.
Now, in terms of preventing and recommendation, it's important to recognize that men and women may require slightly different approach to protect their cardiovascular health. Regular screening are essential. Men should start checking cholesterol and blood pressure earlier, while women need consistent monitoring, especially after menopause when heart disease risks increase. A balanced diet with more fruit, vegetable, whole grain and less saturated fat plays a major role for both gender. Physical activity is also key. Men usually benefit from higher intensity workout, while women tend to gain more from steady, moderate exercise throughout the week. Avoiding smoking, limiting alcohol intake, and managing stress are equally important, although the source of stress may differ between gender. Weight management is another crucial aspect. Men often accumulate fat around the abdomen, which raises heart risk, while women may gain weight after menopause due to hormonal change. Awareness of gender-specific symptoms is also vital. Men tend to have typical chest pain, while women may experience nausea, jaw pain, or unusual fatigue. Finally, personalized healthcare considering lifestyle, hormones, and genetics can greatly improve preventing and treatment for both male and female. By understanding this gender difference and applying targeted strategies, we can significantly reduce cardiovascular risk and improve long-term outcome for everyone. To conclude, cardiovascular health is not the same for everyone. Men and women experience heart disease differently because of hormonal influence, lifestyle habit, and genetic factors. Estrogen protects women at younger age, while testosterone and lifestyle pattern increase risk in men early in life. Genetics further shape how each gender handles cholesterol, blood pressure, and medication response. This difference also affects how heart disease appears. Men often show classic chest pain, while women may have silent or unusual symptoms which can lead to delayed diagnosis. Because of these biological and behavioral variations, the outcome of cardiovascular disease can be very different between male and females. By understanding this gender-specific pattern, we can improve preventing, encourage earlier screening, and design treatment strategies that are more accurate and more effective for everyone. Cardiovascular health is truly influenced by the combination of hormones, lifestyle, and genetics, and recognize this difference can ultimately save life.